Good afternoon et bon après-midi à tous. Thank you for joining us for today's media availability on the novel coronavirus COVID-19. Merci de vous joindre à ce point de presse au sujet du nouveau coronavirus COVID-19. Before we begin, I'll go over the usual items. A reminder to please place your microphone on mute until I invite you to speak or ask your question. You can view who is speaking on Zoom by selecting Speaker View in the gallery. That button is on the top right corner of your screen. Merci de bien vouloir désactiver votre microphone jusqu'à ce que je vous invite de poser votre question. Veuillez aussi changer votre écran en mode speaker en anglais pour mieux voir les porte-paroles. Le bouton est situé en haut à la droite de l'écran. Reporters with accessibility needs can pin the interpreters or follow along on the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent avoir recours aux interprètes ou suivre la diffusion en direct sur YouTube. Today, we will be hearing remarks from Councillor Keith Eglai, Chair of Ottawa's Board of Health, Dr. Vera Etches, Chief Medical Officer of Ottawa Public Health, as well as Dr. Alan Forrester, Testing Strategy Lead for the Champlain COVID-19 Response Committee. Nos porte-paroles aujourd'hui sont le conseiller Keith Eglai, président du Conseil de santé d'Ottawa, la Dr. Vera Etches, médecin-chef en santé publique à Santé publique Ottawa, ainsi que Dr. Alan Forrester, vice-président de l'hôpital d'Ottawa et responsable de la stratégie de dépistage de l'équipe régionale de planification de la COVID. Je passe maintenant la parole au conseiller Keith Eglai. Please go ahead, Chair Eglai.
Thank you, and good afternoon, everyone. Thanks for joining us today. I know many of you will have questions and concerns about the latest numbers reported in the city, but before I get to that, I would like to quickly touch on a couple of subjects. First, with respect to wait times, I want to acknowledge that we've been getting feedback about long wait times at Ottawa's COVID-19 testing locations. While Ottawa Public Health is a partner in the overall testing strategy for Ottawa, the Champlain COVID-19 Response Committee has the lead operational responsibility for providing local testing for COVID-19, and through local hospital partners, it staffs, operates, and manages the current testing sites in Ottawa. Staff at the assessment centers and care clinics have been working hard to increase the efficiency of the processes within the sites and to increase the number of people they are able to test in a day. Further, by increasing staffing, extending hours of operation, and planning for additional sites, they continue to adjust operations to create more testing capacity. In the interim, I urge residents to not only present for testing, to only rather present for testing if they are experiencing symptoms of COVID-19 or if they've been recommended for testing. We also ask for your patience and understanding as the CCRC continues to work to grow local testing capacity. The second topic I'd like to address is the return to school, which is top of mind for many of you. This September has been like none of us have ever experienced. There's been excitement and anticipation for some, but there's been also a lot of anxiety and trepidation for many. Ottawa children and youth have been out of school since early March, which presented challenges for many in our community. Parents of school-aged children have reported poorer mental health and higher daily life stress and other subpopulations of Ottawa than other subpopulations of Ottawa adults. They also reported being concerned about their children's mental health and emotional well-being. Moreover, all of society is impacted when people cannot rely on schools to support childhood development and economic activity. For these reasons, OPH has prioritized working with local school boards towards a safer return to school this fall. Specifically, OPH has been meeting regularly with local school boards and continues to meet with them weekly to review plans and feedback, answer questions, and provide guidance to ensure that our schools are and continue to be as safe as possible for students and school staff. However, keeping children and youth in school requires that we all do our part to keep COVID-19 transmission as low as possible in our community. It is also important for parents to understand what will happen if a child or staff at their child's school test positive for COVID-19. To help with that, OPH has created a webpage dedicated to supporting schools during COVID-19. On that website, parents can find information about processes and protocols that have been put in place for communicating information to them and for following up with any confirmed COVID-19 diagnoses associated with local schools. I encourage parents and guardians to visit that page and become familiar with some of its content. Finally, I want to urge everyone as we enter the fall and the school year to continue to be COVID wise. The basics have not changed. Physically distance at least 2 meters. When that's not possible, wear a mask and regularly wash your hands. These simple actions work. They protect you and those around you. Please stay the course. I'm now going to turn it over to Dr. Etches.
Thank you. Good afternoon, everyone. Bonjour. Over the last few days, Ottawa Public Health has seen an increase in the number of individuals who've tested positive for COVID-19. On Monday, the number was 61, and today we're reporting 52 new cases. We haven't seen numbers this high since May. So I have three very clear and important messages today. The first one isn't new, but it can't be said enough, and I am concerned that some people have forgotten. We must limit our close contacts. Close contacts are people that we see, particularly indoors, without masks on, where 2 meters distance is not kept for more than 15 minutes. Nous devons limiter nos contacts étroits. Ces gens sont ceux avec qui nous passons du temps, surtout à l'intérieur, sans masque, à moins de 2 mètres de distance, et pour plus de 15 minutes. Par exemple, une 5 à 7. So provincial guidance limits social circles to 10 people. However, it may not be clear to people that these groups of 10 cannot mix with other circles without greatly increasing the risk of COVID-19 transmission. So less is better. And my strong recommendation is to prioritize your household members and any essential supports, such as childcare workers, the neighbors that help you, grandparents. But keep your distance, wear masks, and stay outside with anyone else. Ma forte recommandation est de prioriser les membres de votre famille et les personnes ressources essentielles, telles que l'aide à la garde d'enfants ou pour les grands-parents. Gardez vos distances, portez un masque et restez à l'extérieur avec toute autre personne. I've been talking with the province about how to provide clear direction that without these layers of protection, our social gatherings must be smaller. And where is this increase coming from? It takes time to investigate the source of transmission for each of these cases and identify trends, but it is clear that a large proportion of transmission is occurring primarily in private social gatherings, such as parties, but not just parties. It's gathering for a drink after work. It's having some family get-togethers where you might come into close contact with multiple people. So we all need to reassess our behaviors. We've seen how just one person with cold-like symptoms who attends a small get-together can lead to 40 people testing positive in a short period of time. Nous devons tous repenser nos choix. Aujourd'hui, je vous demande de bien réfléchir à vos comportements sociaux. Today, I'm asking you to check in regarding your social behaviors. Ask yourself, how many close contacts have you had recently? And again, close contacts are those who you spend time with less than 2 meters apart with no mask on and where other precautions are not in place. Are you spending time with the same people every day or different groups? Do you have an understanding with your close contacts not to have close contacts with others outside of your group? Or are you potentially connected to a long chain of transmission? And I know parents may be asking how limiting our close contacts matters if our children are attending school in person, where it seems like contacts are already increased. However, these settings in schools have extra precautions in place. And if you have your children attending school in person, like I do, you need to increase precautions that your family takes outside of the school setting. Large gatherings with close contacts, even with the same school friends, are not a good idea. So it's not an all or nothing approach. Nobody's perfect. Each decision we make to reduce the risk helps. And it's our collective actions that are what adds up to keep our community safe. My second message is that Ottawa Public Health is currently only recommending COVID-19 testing for those who show symptoms of COVID-19 or if you're a close contact of someone who has tested positive for COVID-19. Santé publique Ottawa ne recommande le test de dépistage pour ceux et celles, je vais répéter cette phrase parce que je voudrais mettre le bon emphase. Santé publique Ottawa ne recommande le test de dépistage que pour ceux et celles qui présentent des symptômes de la COVID-19 ou qui sont en contact étroit avec quelqu'un qui a reçu un test positif. Aucune personne sans symptômes devrait prendre un test sans l'avis de santé publique. So if you do not have symptoms, you do not need to go for a COVID-19 test unless recommended by Ottawa Public Health. We're hearing of very long wait times at testing sites, and we need to prioritize testing for those who have symptoms or are close contacts and have been instructed by Ottawa Public Health to go get tested. We need the laboratories to have the capacity to be able to provide rapid turnaround times to manage outbreaks and to get people back to school quickly. The purpose of a test is to determine if you have COVID-19 so we can provide information on treatment, identify your close contacts, and prevent further spread. So instead of engaging in activities that give you a concern that you might need to go for testing, please rethink the things you are doing and with whom to reduce your risk and testing. If you feel you need to go for testing because of your actions, refocus on changing those behaviors that put you at risk. Le but d'un test est de savoir si tu as le virus afin que nous puissions fournir des informations sur le traitement, identifier les contacts étroits et empêcher la propagation. So together with our hospital partners, we're working on ways to adapt the testing strategy to meet the needs of the community as the situation with COVID-19 pandemic changes. We're improving access to testing for children and families as a top priority to keep people in school. My third and final message is that we are concerned about the rise of individuals testing positive in long-term care settings. Je suis préoccupée par l'augmentation du nombre de tests positifs chez les résidents des foyers de soins de longue durée. When there's more COVID in the community, the risk of it entering long-term care homes where death is a devastating outcome increases. So Ottawa Public Health recognizes the substantial challenges that facilities face in safeguarding residents, the staff, the family, essential visitors. However, strict adherence to infection prevention and control best practices and outbreak management guidelines is essential to reduce transmission of COVID-19 and other illnesses among our most vulnerable. We continue to work closely with the province and with owners of long-term care homes to ensure that the guidance and outbreak management is clear and carried out in a timely manner. Ottawa Public Health is seeing an increase in the number of Ottawans who test positive and in the number of close contacts that people have. We're seeing an increase in outbreaks at long-term care and retirement homes, and there has been an increase in deaths. Nous devons agir ensemble pour contrer ces augmentations. Les décisions et actions que nous prenons aujourd'hui ont un impact sur le futur proche. So we must act collectively to counter these increases. And the decisions we make, the actions we take today will directly impact our situation in the near future. Merci, Miigwech. Thank you.
Thank you, Dr. Etches. Je passe maintenant la parole au vice-président de l'hôpital d'Ottawa. Please go ahead, Dr. Forrester.
Good day. Thank you for giving me this opportunity to speak. I'd like to begin by telling you what is being done to increase the region's testing capacity. We know people are frustrated by the long lines, and we hear you. None of us want this to happen, believe me. These weeks tell us that with the COVID-19 surge we're seeing now, the expansion of services so far is not enough. We have recently increased staffing and added a new site, and there's quite a bit more in the works. Because Ottawa continues to have a large portion of the new provincial cases, we will continue to build capacity, but we also need the residents of Ottawa to continue to wear masks, physical distance, and to stay home from work or school if you have symptoms of COVID-19. I'm here on behalf of the Champlain COVID-19 Response Committee, which is coordinating these testing efforts. This committee is made up of healthcare partners throughout the region. It includes hospitals in Ottawa, Ottawa Public Health, paramedics, and partners in care. Our work is based on guidance provided by Ontario Health as part of carrying out the government's testing strategy. As we shared yesterday, we have seen record-setting volumes at the COVID-19 testing sites. We knew that in stage 3 and with kids returning to school, we could see these volumes. To prepare, we had tripled staffing in the last month for testing children and youth at the center. More are being trained and still more are being hired. Additional staff are being trained to extend the hours of operation at the Brewer Assessment Center by 4 hours a day to 12 hours of operation, 7 days a week. The hours for the drive-through assessment center on Coventry Road will be extended as well. And the technical issues related to the booking system have been resolved. The extended hours will begin as soon as staff are trained, and we aim for that to occur within a week. We will be letting people know with your help and through social media when those new hours are in effect. We are looking also to expand the hours of operation for the care clinics run by L'Hôpital Montfort and the Queensway Carleton Hospital, and we are exploring options for additional testing sites. In terms of the long lines, the new drive-through facility at Coventry Road is based on online booking. The IT issues which we saw in the initial days have been resolved, and we are now considering how to roll this online booking system out to the Brewer Center. We also have mobile testing capacity. So if there is an outbreak in a school, we can send a mobile unit to that school to do the testing. In the meantime, that capacity is added to what we can offer at Brewer. That brings me to a call for action I have for the community. We are actively seeking healthcare professionals, perhaps retired nurses, who would be willing to join the effort to combat COVID-19. The region's ability to increase testing capacity and open more testing sites is affected by the human resource pool that is available. The pandemic means that there is increased demand for care providers. We are seeking for the testing facilities that I've just talked about. This finite human resource pool is now providing more care in hospitals, staffing more in long-term care homes, and there are more nurses in schools. This is all essential work. So if there are healthcare retirees willing to join the effort, they would be more than welcome as we build the additional testing capacity. It would be helpful to understand the reasons why we test. First, to diagnose people who have COVID-19 symptoms, so they have access to any treatment or advice they need, and know to remain in strict isolation until they are no longer infectious to others. Second, we perform testing to perform contact tracing and follow the spread through the community to ensure that anyone who's been exposed to COVID-19 is aware of their options. And three, we do so to proactively identify cases among high-risk populations, which includes long-term care homes. We are working day and night to increase our ability to test people, which requires us to create additional capacity in the local lab to get folks more timely results. The testing strategy continues to evolve, and tomorrow the CCRC, or the Champlain COVID Response Committee, will be speaking with city councillors to continue the collaborative nature of this historic effort. There is a lot in the works, and we know we want to do more. I hope to have more we can tell you about this in the near future. We all want what is best for those who need care and who need testing, but we also need everyone to help. Let's do everything we can to bring down our infection rates so Ottawa isn't a hotspot. Wash your hands, physically distance, wear your masks, and stay home if you aren't well. It all makes a difference, and everyone can make that difference. Thank you very much.
Thank you, Dr. Forster. In the interest of time, I will read through the list of media who have registered for today. No need to indicate if you are present. However, if I've missed your outlet, please speak up after I'm through the list. Vous n'avez pas besoin d'indiquer si vous êtes présent, sauf si je n'ai pas nommé votre agence. TFO, Radio-Canada, Ottawa Sun, Ottawa Citizen, Le Droit, iPolitics, Global News, CTV News, CBC Ottawa, The Canadian Press, Blog on the City from the Burbs, and 1310 News. Have I missed an agency? Est-ce que j'ai manqué quelqu'un? I see no one. I will now invite each agency in reverse alphabetical order to ask their question. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique, inversé. Chacun pourra poser une question et une question de suivi. We will now start with TFO. I think we have Étienne Fortin. C'est à vous. TFO. Alors, on passe à la prochaine personne, Radio-Canada. Jean-François, c'est à vous.
Oui, est-ce que vous m'entendez?
Oui, on s'entend.
Vous m'entendez? Oui, OK, oui. Parfait. Une question d'abord pour Madame Mise. Bon, je sais que ce sont les hôpitaux qui gèrent, en fait, le service Champlain qui gère les sites de testing, mais est-ce que vous pouvez recommander, en fait, qu'il y ait un autre centre qui ouvre dans l'est de la ville d'Ottawa, à Orléans ou, par exemple, à Cumberland? Est-ce que c'est quelque chose que vous aimeriez voir?
Absolument, c'est un grand partenariat qui est responsable pour gérer l'accès au dépistage dans cette région. Et c'est important de continuer d'augmenter le nombre de points d'accès. Alors, dans l'Est, oui, c'est important. C'est aussi important partout la géographie. Et mon collègue avec le comité de répondre au COVID dans Champlain a expliqué qu'il y a beaucoup de différents plans maintenant qui déroulent. Et c'est d'identifier un lieu à l'Est.
Comme suivi, pour ce qui est des centres de dépistage, on voit beaucoup de jeunes familles, des enfants là, qui se retrouvent à devoir prendre des tests en raison là, des classes qui recommencent et des familles qui sont un peu découragées ce matin de devoir revenir pour une deuxième fois même et espèrent que ce ne sera pas le cas comme ça pendant longtemps. Qu'est-ce que vous pouvez dire à ces gens-là, en fait, qui comme ça, là, doivent prendre du temps de leur travail, tout ça, et qui risquent d'en prendre souvent pour venir faire tester leurs enfants?
Je voudrais dire quelque chose pour les familles qui ont la difficulté d'une file d'attente pour leurs enfants. Mais mon message, c'est pour toute la population qui n'ont pas les symptômes. N'allez pas trouver un dépistage si nous n'avons pas des symptômes, sauf que Santé publique Ottawa a demandé que vous avez un dépistage. C'est important d'avoir un système de prioriser, d'assurer que les familles sont la priorité avec aussi les gens avec des symptômes et les contacts étroits des cas positifs. Alors, c'est pourquoi Dr. Forrester a expliqué on a le plan d'avoir 12 heures par jour pour les familles à la centre Brewer, d'avoir plus de capacité pour les familles. Et c'est certain que nous avons aussi l'option d'avoir une approche plus près des écoles s'il y a une éclosion. Mais pour maintenant, c'est le centre qui existe et il y a des plans pour augmenter la capacité. Et aussi, je voudrais expliquer aux familles parce que je pense que peut-être quelquefois le message n'était pas clair, que c'est juste l'enfant avec symptômes qui a besoin d'un dépistage. Ce n'est pas toute la famille, ce n'est pas tous les enfants dans la maison. Quand un enfant a une maladie, c'est juste l'enfant avec les symptômes qui ont besoin d'un dépistage. Et c'est aussi c'est similaire quand il y a un étudiant qui était identifié comme un contact étroit d'un étudiant dans une école. C'est pas toute la famille de 7 étudiants, le contact étroit, qui a besoin de faire un dépistage, qui ont besoin de faire un dépistage. C'est juste des contacts étroits. Alors, ça peut diminuer le nombre des étudiants et jeunes personnes dans les files et aussi, oui, pour tout le monde, si nous n'avons pas les symptômes, nous n'avons pas besoin d'un dépistage, sauf que c'est Santé publique à Ottawa a demandé que vous faisiez ça.
Merci.
And next up, we have the Ottawa Sun. Liz Payne is on the line. Liz, the floor is yours.
Thank you. You can hear me okay?
Yeah. We can hear you well.
Thank you. It's for Dr. Forster. Can you tell me what the overall capacity for testing locally is right now versus what it will be with these changes? If you know.
Yeah, we're currently running, this week we got to just over 2,000 tests per day. We're seeing that with the extension of hours, you know, we look to get up to about 3,000 a day. If we put in mobile testing, you know, we can add another 400 or 500 tests per day. So those are the initial numbers we're aiming for. Those are, you know, the timelines to achieving those numbers depends a little bit on the staffing, which I alluded to in my presentation. They also, we also have to pay attention to the back end, which I've talked about previously, which is the testing capacity in our labs. If we exceed certain thresholds, we need to send tests off to Toronto to be performed there. And that can increase the turnaround time.
Okay, this isn't my follow, but what is that threshold that the labs can handle right now?
We're looking at around 2,000 to 2,500 a day right now.
So that's effective. Yeah, okay.
Basically the same that we're doing. You know, we're ramping up the equipment and the materials at the same time we're trying to ramp up the human resources, as well as the physical places where we do it.
Okay, and as a follow, the Premier today said that pharmacies said he's not going to announce it now, but heavily suggested that pharmacies are going to be a place where COVID testing can be done under certain circumstances. Are you working on that in Champlain Park, and or Champlain region? What can you tell me about that?
We haven't actively worked on that as a component of our strategy to date. But we're willing to work with and open to working with any partner that could facilitate the testing.
So you don't know any more about when that could be coming? Could make a huge difference locally, I would think.
I'm not ready to speak to that. We do have, as I said, the front end and the back end. So pharmacists may be able to help us with taking the test, but there's a bunch of logistical issues, as well as the testing capacity we would have to filter into that.
Okay, do you mind just one final, is HR, like people that's a big issue right now, right? To getting up to capacity, is that a big issue in the lab as well, to getting beyond 2,500 tests a day?
Yes. Okay. As I mentioned, the staff, you know, we need human resources in a bunch of areas. And unfortunately, that's why we have to work as a region and why we have to make sure our priorities are lined up, because, you know, we have a limited human resource pool as we increase our support of long-term care, as we increase our support for the schools, as we increase our, you know, we're trying to catch up on our surgeries and other clinical activity that we slowed down in the fall. You know, those are all people having to do that clinical work. And, you know, we have to make tough decisions about where they go. And that's why we have to work collectively. That's why we're working with all of the hospitals. That's why we're working with public health. That's why we're working with other care providers in the community. You know, and that's why we're engaging with the public through forums like this.
Thank you.
Thank you. The next question will be from the Ottawa Citizen, Bruce. I think we have Bruce on the line.
We do so. Can you hear me?
We sure can.
Great. My question is for Dr. Etches. Last week, following the cottage incident, and again today, you said that the main concern with the uptick in cases is social networks and not businesses. And I'm wondering if OPH can share the data that supports that.
Yes, we're happy to look at how to make that more accessible. But it's there, in terms of the cases are most often either related to an outbreak, which is on our website. We report all the cases related to an outbreak, or they are not able to be traced, and that percentage is on our website as well. It's about 25%. We're not able to link back to an outbreak or a specific exposure. So then the rest of the cases are what we call sporadic, and they are either usually linked to a household close contact or a social group close contact. That is the most common source of exposure. We have very few workplace outbreaks that have been identified, but we know everything's connected. And so the gathering we have with work colleagues after work, it makes a difference for the workplace, and people go back and forth. And so the call today is for each of us to think about how many close contacts did you have this week, where you were within 2 meters, especially indoors without a mask on. And in each of those situations, that could be connected to a chain of transmission. And so we want everybody to do their part to decrease those number of close contacts in our lives.
Can those numbers be further mined then to determine, say bars and restaurants, health clubs, where many of these are coming from? If not the individual businesses, at least as a grouping.
Yep, we understand there's interest in exposure information. I'll take that back to the team again. I mean, we don't have really any outbreaks that are, again, still identified related to a restaurant so far, but it doesn't mean it's not there. We just might not be picking it up in that setting. We're picking it up when people report close contact with others who have tested positive. And that's the main driver.
Thank you.
Thank you. Our next question, ce sera de Le Droit. Je crois qu'on a Julien Paquette. C'est à vous.
Oui, bonjour. Dr. Etches, le premier ministre aujourd'hui a évoqué la possibilité qu'il y a des annonces concernant les régions d'Ottawa, Toronto et Peel dans les prochains jours, comme c'est les 3 régions où il y a le plus grand nombre de nouveaux cas depuis quelques jours. Est-ce que ça veut dire qu'il faut s'attendre à au retour de certaines restrictions pour le contrôle de la transmission du virus?
J'ai eu l'opportunité de parler avec le Premier ministre et j'ai expliqué la situation, j'ai juste mentionné en anglais, qui est la source de notre infection et la transmission de la COVID-19 dans notre communauté. C'est pour la plupart les rassemblements avec nos proches. Alors ça, c'est la situation. On a besoin de cibler et d'attaquer avec une énergie renouvelable. Peut-être on peut dire c'est important pour nous de réfléchir et diminuer le nombre de contacts proches, étroits, le nombre de contacts étroits. Et c'est le point clé que j'ai mentionné dans mes conversations avec la province.
C'est un message que vous répétez depuis plusieurs semaines déjà, que c'est important de faire attention et de respecter faire des rappels sur les règles à respecter et de limiter les contacts étroits. Comment vous vous sentez dans le fond qu'on se retrouve dans cette situation-là aujourd'hui où on est encore, ça devient presque un cri du désespoir dans le fond là, de faire en sorte que les gens entendent ce message-là?
Je pense que c'est complexe, l'idée d'un cercle social et le nombre de personnes on peut avoir dans un groupe à l'intérieur, à l'extérieur. Pour moi, aujourd'hui, je voudrais retourner le message aux bases, c'est de diminuer nos contacts. Peut-être c'est trop complexe quand on discute le cercle social et les différents aspects comme ça. Et je voudrais aussi souligner que c'est peut-être vos contacts. Beaucoup de gens pensent que ce n'est pas dans leur réseau ou leurs proches, mais c'est possible. C'est pourquoi c'est important pour tout le monde de réfléchir encore et de penser comment on peut réduire les contacts étroits. Oui, on a des discussions comment on peut avoir plus de clarté dans ce message avec la province, d'avoir la même approche, de cibler cette risque.
Merci.
Merci. The next question will be from iPolitics. Charlie Pinkerton, the floor is yours.
Good afternoon. My questions are for Dr. Etches, please. So last week, the Premier here in Ontario, he suggested that with cases rising, that it would be the medical officers of health who would be charged with reintroducing restrictions in places like indoor dinings, gatherings, bars, things like that, using the authority of Section 22 of the Health Protection and Promotion Act. Some other jurisdictions that we've heard from agree that yes, this is within their power, while others have said that it isn't. So I'm just wondering, firstly, do you agree with the Premier that you have this power should you want to use it? And would you be willing to use Section 22 in this fashion to shut down bars, restaurants, if things keep on going in the recent trend that we've seen?
You actually have a lot of questions in there. So let me start with saying that I think what the Premier is getting at is that there are local contexts that differ. There are local contexts where the local level, yes, sure, the medical officer of health is in a good position to be able to say what is needed to reduce the risk in that area. When it comes to the risk that I'm highlighting today for all of us to take a look at again, our number of close contacts in our lives that are potentially involved in long chains of transmission, that is not clearly something I can tackle with a Section 22 order under the Health Protection and Promotion Act. If I establish an order that somehow can be warranted, I have to take people to court to enforce it. And so we have a tool in the provincial regulation that speaks to social gatherings, and that tool allows our bylaw officers and our police officers to do enforcement and to issue tickets. So this is a mechanism that we've seen work for the rest of the pandemic response and the actions we needed to have enforced. And so this is part of the discussions that we're having with the province about how to proceed.
Okay, and I believe I have a follow-up. Is that right?
All right, yes, well, you do.
Okay, great.
Maybe just try asking one.
Okay, great. So just still in terms of what the Premier said about Section 22, that is because what is happening in Ottawa, where it's more personal parties and not things like bars and restaurants, I guess should it turn in that direction, I'm hoping you can sort of outline the thought process behind using that Section 22 as a medical officer of health. What would have to go through your mind? What would have to be happening for you to invoke that?
So I actually have the chair of my board is a lawyer. He's going to hold me to account to make sure I'm following the law, which is set out to have checks and balances. The Health Protection and Promotion Act requires that there is evidence of a risk to the health of the population, and that the risk must be addressed with the action specified. So the action specified must be, necessary to address that risk. And so those are the two main elements, where then I also need to be able to to make sure people are notified and there's process for follow-up. So the evidence of the risk for specific settings, is something that I'd be looking for to make a more specific order. And I'd also need to know that there's not another way of attacking that risk and changing that behavior or that risk. So that's the kind of thought process that I would be going through.
Okay, thank you very much.
Thank you, iPolitics. A friendly reminder to all of our reporters, it is one question and one follow-up, please. We'll now be hearing from Global News, Craig Lord. Please go ahead.
Thanks very much. Just a question for Dr. Forster to start. I believe you alluded to it there at the beginning. You said, we anticipated these higher volumes with the return to school, but could you please maybe speak to and spell out what exactly is driving the current demand that we're seeing at the Brewer Assessment Center?
Right now, it's children and families, and really that's it. And so, that's put a pressure on that operations. It was predominantly adults before, now it's changing over, and so we're having to adjust and react to make sure we have the ability to meet the demand for a group of 4 or 5 people showing up together, where you have children and adults mixed together.
If I may also add to that, we do see among the adult population people who don't need to be there for testing. People who are asymptomatic, who don't have a history of an exposure. And so, we want to have the space to prioritize those families where there is symptoms. And I explained earlier in French, not all of those family members that are showing up need testing either. So if it's somebody who has symptoms in the family, parent or a child, it's just the person with symptoms who needs to be tested. So really, it's not the whole household. And in the situation where somebody is referred by public health to be tested because they've been a close contact of a student or a teacher who's tested positive, it is only that close contact who needs to be tested, not the whole household. So I think we are working to make sure the messaging is clearer for families and for the whole population about when you do need to be tested and when not. Most simply, it's if you have symptoms or you have been referred by public health.
I'll just add, just to finish that up, is that the asymptomatic person, someone showing up for testing for a peace of mind or for other reasons, because they're, sometimes we have people showing up because they're about to attend a social event. Those kinds of, they are the majority of people showing up, actually, the asymptomatic people. And that actually does create a lot of pressure because, you have people in the line who have symptoms who should be really have those, or who are contact tracing, but then there's a large portion of people who are there asymptomatic really for that social reason that we've been talking about.
And maybe just on that, and Dr. Etches, feel free to jump in as well. What is the recourse or the option available to asymptomatic people who do want that peace of mind? Is it just that they have to wait it out, or what is the way for them to get that peace of mind and not clog up the testing queues at these centers?
I would start by saying that if you are uncomfortable and feel you need a test because of some of your exposures that potentially happen, to stop engaging in those behaviors that give you exposure to someone within 2 meters indoors without a mask. That's the first thing that will give you peace of mind. If you practice those behaviors, you're not likely to pick up the COVID virus. We're expanding our capacity across the testing system. So, we're not trying to exclude people who don't have symptoms, but we're saying that's not the priority. And we need to make sure there's capacity for those who need the testing. And then, that really is the first priority: control of outbreaks and families who need to have children in school.
I would add that testing asymptomatic people in the absence of some exposure is risky for the person. There's a chance of false positive test which is not, which has an important implications for that person, and can create other problems. So I would just add that sometimes that peace of mind is not, it may be made worse. The other part is, of course, that there often is a false sense of security, because if someone is asymptomatic, it doesn't mean that they're going to be like that they won't become symptomatic later, and that so they may be negative on the day they're tested, and then become positive, a few days later. So for both reasons, it's better to wait until you have a symptom, or if you're part of an outbreak investigation, those would be the reasons where I think that they would be useful.
Thank you.
Thank you. We'll now take questions from CTV News.
Hi, Stefan from CTV here. Just wanting to ask, perhaps start with Dr. Etches, if the messaging or if there will be campaigning that is more targeted towards young people as we start to see a rise in cases in people under the age of 40.
Yes, we're continuing our work to reach young people through targeted channels. So we have the link is a dedicated website. We're using Instagram. We're working with colleges and universities, different media channels that reach that population. So we are continuing to focus communications on that population.
As a follow-up, just how can OPH engage in sensitive messaging when we recently had the discussion around stigmatization and language, and I'm getting some feedback from some people, particularly in their 20s, is that they feel targeted and blamed and shamed, and sometimes the economy has reopened and they are in frontline workers, they are in zones that they don't have control of. And it's not necessarily from careless partying. And that seems to be not necessarily from OPH, but maybe even from the provincial level, how it's being described.
Well, I agree with you. It's not helpful if people are feeling blame and shame, because most people, they don't have control over all the things that give them risk of coming into contact with COVID in their environment. So that is true. People work in higher risk settings. People live in households where it's harder to isolate when one person tests positive, to keep the whole household from also testing positive. So these are difficult things beyond an individual's control, and that's why I try to regularly thank young people for going forward when they have symptoms to be tested. It's good that we're detecting the virus and being able to do the follow-up required in this age group. And so, certainly, I think if you take a look at our communication channels, our tone is one of recognizing and thanking young people for doing their part. Most young people are absolutely concerned about the worst outcomes we can see with long-term care homes having, COVID introduced. Most people are very concerned about their parents and grandparents. So continue to say thank you for that and encourage people just to check in again at what more we can do to limit our contacts across all age groups.
Stefan, our messaging is going to continue to be very broad-based, like I said earlier, and Dr. Etches and Dr. Forster as well. We'll make him an honorary member of public health for today. The basics of staying physically apart, wearing your mask when you can't, washing your hands, and staying home if you're not feeling well. And that's whether you're 40 or 84, the same message, and we're going to continue to push that out. It's like Hill Street Blues at the beginning where he'd say, be careful out there. And that's our message. Be careful out there to everybody, regardless of your age group. Practice those basic COVID-wise habits, and that will go a long way towards reining back in the spread of the virus.
Thank you for your responses.
Thank you, Stefan. The next questions will be from CBC Ottawa. I believe we have Joanne on the line.
Hi, thanks. Hi, folks. I was going to ask a different question, but I'm a little bit taken aback by Dr. Forster's comment that asymptomatic people who should not be getting tested are the majority of the people showing up. So just trying to get my head around, when you say there's like more than 2,000 people coming, how many are getting turned away, and who are they made up of, right? Who should be there? Because obviously this messaging is getting lost somewhere. So I'm not sure who wants to answer that. Maybe both doctors, I'm not sure.
I think I do need some help from Vera on this one, but I will say that, it is surprising, I think, to most that the majority of people that have been going for testing are asymptomatic. And one of the measures we track is the proportion of people who have positive test results. And we do that very closely, but just to be, over the last, over the summer, that number was around 1%. It's jumped up a bit now so that about 2% have been positive, just under 2%. And that's a measure of the sort of the degree to which people are coming in for testing and who have a likelihood of disease. Just to put into perspective, in the spring when we were with the outbreak, it was around 6 or 7% at the peak. So we're like that does reflect that we are testing a lot of people now. In order for us to move forward, and I think this is really where we get into the participation and partnership between the testing operations and public health, is how do we make sure that the capacity that we have in place is matching what the demand is? And if the demand is anybody can go for any test at any time, it makes it very difficult for us to get that capacity in place. If we can work closely and come up with an approach that makes sense from the public health perspective, as well as understand where, we do also have to recognize that we've got human beings who have feelings and worries, and sometimes, you get a little niggle in your throat and you're not sure if it's meaningful. So those are all the things that are very difficult for us, for everybody to say, should I go for a test or not? But we certainly are seeing a lot of folks who are just really there because they did have this potential exposure, and they want to make sure that it's not that. And that is actually the majority of people, even now. Vera, do you want to add to that, or?
I feel like I'm starting to repeat myself, but yes, I would say from a public health control of the transmission in the community point of view, there is potential harm when the value of asymptomatic testing is low, and it's displacing people who need to have a test, and the labs need to be able to turn around the results quickly for control of outbreaks and school setting investigations. So this is why I think you hear stronger messaging from us today. When we don't have that pressure, we can handle more asymptomatic testing, although it's never that useful. As Dr. Forster said, it doesn't guarantee that you're not infected because you can have an exposure and it takes 5 days for the virus to show up in a test. And you might be exposed after you leave. It's a one point in time piece of information. So maybe, to be clearer for everyone about the limited value in the test in that situation will help people understand and support prioritizing where it is a useful test.
Okay, thanks. And also, this is an easy question and boring, but I am a little confused as to what the expansion is going to be. So if you guys can just go over the facts or the details of how the testing capacity is going to be expanded. It says brewer to 12 hours. What are those 12 hours? Can you just go over that again? I apologize if I missed it a bit at the beginning.
Yeah, so we're working on the details, so I apologize if it may not be as precise as you wanted at this point, but we're going to extend for 4 hours in the evenings. So that'll go on till about 8 o'clock now, 8 or 9. And that'll be 7 days a week at Brewer. We're also expanding at the Brewer site capacity for children. So that'll be more of a family situation in the evening. The second part of that second part of our expansion is really working with both Montfort and Queensway, the hospitals, to also expand their hours of operation on weekends. We're working through the details of what that'll look like. On the Coventry Road site, we will be going again for a longer day. Again, we're looking for a 12-hour period, a 12-hour day. Currently, we're running that center from 11 to 7. for 7 days a week. And so we're looking again to try and push that out to a 12-hour day. Again, contingent on staffing, as described, we are working to increase our staff that are available for this. And I think the third part, which will help, which I described, would be the online booking. Initially, we tested that out at the Coventry site. It was actually required for that center because of the traffic issues. But we think now we've gotten through some of the kinks that we experienced early on, and we can move that over to the Brewer site, and that should help the flow there.
Will it be, just to clarify, will it also be out to the care clinics as well, or will they still be drop-in?
For now, that we're going to have to keep those drop-in. We're on a different electronic medical system at the Ottawa Hospital and then the other two hospitals, and so we're able to do. We have a capacity to do that with our existing system, which we don't have that capability with those other ones.
And do you have any timelines on that? That's my last thing.
Timelines on the extension of hours or on the booking system?
Both, even an estimate.
Yeah, we're looking within the next 7 days. I can't be more precise than that.
Thank you very much.
Thank you.
The next question will be from the Canadian Press. I think we have Mia Rabson on the line. Please go ahead.
Yeah, hi, Dr. Etches, this might be for you because you mentioned earlier that you were seeing the number of close contacts was rising, and I'm wondering if you can give some more specifics on like what those numbers were and how we're seeing them rise and what impact that is having on how long it's taking to do contact tracing.
Thank you. So early on in the very beginning, before we had stay-at-home kinds of messaging, contacts were up around 15, 20 on average for every person. When you looked back to see where was somebody when they could have been infectious and pass on the virus, that dropped to even down to 2 or 3 contacts through the summer. It's climbed back up again on average. And what we see is it's also the range that matters. So unfortunately, for example, in the school setting where before we had, clearly addressed the ways to confirm where students were sitting on buses, one child might have 50 contacts, in that setting. And so that, we've had the number of contacts as high as 150. And so that's a lot of effort that then has to go into connecting with all of those people as well. And a lot of people who need to go for testing at the right time afterwards. So, the more we heed that very first key message, which is limit your contacts, the less burden on all of these systems, the less transmission of COVID in the community.
Thanks. And I'm also curious, I've seen several reports from parents lately that their kids are just coming down with a normal cold. And yet because of COVID-19, they now have to get them tested and the whole family has to stay home, and then their sibling gets it and then they have to be tested. And it's causing a lot of angst for parents. And I'm wondering what you can tell them to maybe help them get through that and what they should be doing when they are pretty sure their kid just has a cold.
So what we see in Ottawa is that there is a significant level of community transmission. The percentage of people that go for COVID testing that test positive is increasing. So it's possible that when you have cold-like symptoms, that's COVID. And so we have to rule it out. Because if we don't, keep identifying and controlling transmission of COVID, we will end up with exponential rise in the virus in our community. And that leads to overwhelmed hospitals. It leads to increasing numbers of long-term care home outbreaks and deaths. And so, it really is about a new situation. This is not your usual fall and cold and flu season, right? This is where we are in the middle of a pandemic, and we need to take extra caution. In particular, we want to make sure that schools stay open. And so you will learn from this as parents have children that have cold-like symptoms and go for testing. We're taking a look at what percentage comes back as COVID-19. I guess the message also to parents is we want to make the process easier. So we know it's too hard right now to stand in line. And so we want to address that so that the testing is an easier process for everybody and you don't have to take a full day off work, for example. Appreciate that is very difficult.
Thank you. The next question will be from Blog on the City from the Burbs, Sue Sharing.
Thanks very much. I think this is directed to Dr. Etches. It seems to me that from the very start of all of this, your message has been quite straightforward and quite simple. You list the 4 things that we need to take care of. It would seem to me, as someone who's basically been living in their basement for 6 months, that this isn't being followed. Is it time to perhaps reconsider that message? Because it would seem to me, not to be harsh, but it doesn't seem to be working.
It's working pretty well. You know, until we've kept the virus level manageable, the most of the population is doing enough to keep the virus from growing too rapidly. But something's changed in the last week or 2, because there's a delay until we see it, where it isn't quite enough across the board. And so the behaviors haven't changed what we're looking for, but what I think I need to be clearer about in the context of different messaging about social circles and social gatherings and, you know, 50 indoors, that's sent a bit of, you know, kind of we can relax message. You cannot have physical distancing in a private home with 50 people inside, right? So I'm just trying to really underline that. If you have a house that is the average size in Ottawa, you cannot have a gathering of 50 people and have physical distancing. So we need to relook at what it means to limit your close contacts. And that means limit the number of people where you have, you know, that inside, no mask, within 2 meters kind of contact.
A follow-up question, Sue. I think you might still be muted.
There's been several people who've had 4 questions total, so I hope I'm not being discriminated against. The first question wasn't totally answered. Okay. Are you having to reconsider some tougher measures?
Well, I've been in contact with the province, certainly, about what more we can do to address the social gatherings. I do think that we may need to have more ability to enforce the gatherings that are causing risk in the community.
And as my second question, and I know I'm asking you to look into a crystal ball, but I think so much of you, I think you can do this. What should we be expecting? There are a lot of people who are saying at the end of 2021. Do you have any thoughts on the way this is all progressing? And I'm not, you know, I know that it's a hard question to answer, but it doesn't seem to be getting better quickly through, you know, for whatever reason.
Yeah, there were 3 scenarios I spoke about, you know, in the summer as we were approaching the fall. The first scenario was the best case of being able to try to keep the level manageable out of vulnerable populations like long-term care homes, keep the hospitalizations manageable, which they still are, fortunately, but that's a lagging indicator. So we may see with this rise in cases, hospitalizations go up as well in the future. But the aim there is manageable level, and I think we can do it. I do. You know, we've done it so far through the summer into this period with the behaviors that we've learned. Now, the worst case scenario is it gets ahead of us, and there's so much community transmission happening that we don't, you know, keep it out of long-term cares and hospitalizations, and you know, we can't keep up with the contact tracing. In which case, you know, then we would have to look at even more measures. And so that is possible scenario as well. In 2021, I mean, what I'd like to see is that we've made it through, we've kept things manageable, and we've decreased the risk to vulnerable populations. And we're at a point where we're trying to immunize the whole population. That would be the best case scenario too.
Thank you. Our last question will be from 1310 News. I believe we have Alex Goja on the line.
Hello. So this is for Dr. Etches. So with Doug Ford said during his presser that he would soon introduce new guidelines for virus hotspots in Ontario, which includes Ottawa. How in favor is Ottawa Public Health of this?
We're in favor of a risk-based approach, absolutely. We know that larger centers are always going to have a greater risk of transmission of COVID for many reasons, density of the population, just sheer numbers of people. And so we absolutely support an approach based on risk.
And in the event of any further lockdowns, what would Ottawa Public Health public information platform and way you've been communicating to the public via Twitter and whatnot, would that change at all with the potential clawback of any openings and whatnot?
We are always open to learn and adapt to be as effective as we can. I don't see us changing the way we've been reaching out to you through media availabilities, our use of social media. Those things would continue. But we are trying to take more targeted approaches as well with communities who face barriers. We spoke earlier about younger populations. So again, I'm not at a place where I think that we need to shut down businesses or anything like that. What I'm here today to really emphasize is that we need to limit our close contacts, and that's us in our social circles or social environments.
Thank you so much.
Thank you everyone for your excellent questions and for showing up today. That's all the time we have. Merci d'avoir participé au point de presse. On vous souhaite une excellente journée. Thank you.
Merci.
Thank you.